Welcome back to Talk of Alabama. It's Women's Wednesday on the show, and we welcome Dr. Daniel Rousso with Rousso's Facial Plastic Surgery Clinic and Aesthetic Medical Spa. Good morning.
Good morning, Nicole.
Hey, you know, to our viewers, this is a brand new concept we're working on Skype. So you are at your office over on 280, and you are taking a quick break between surgeries to talk with us for a minute about things that you can do that can help everybody look good on short notice, right?
That's correct. We're looking forward to, spending some more Wednesdays with you and talking about other things. But today we're going to talk about some things that patients can do where they can get back into their activities very quickly with minimal downtime at all.
Now, one of those things, I know that you've got Botox, and one of the first pictures we're going to show is actually Botox, and it's Botox to the forehead.
That's correct. Botox has been around for a long, long time now, and we've been using it for over 10 years for cosmetic reasons. It's great for the forehead and the upper third of the face. It's great to relax some of the wrinkle lines that you see on the forehead area, between the eyebrows. It's great for the crow's feet. We've got some pictures of that, I think, on another patient. But you have to kind of tell me how you're progressing on your pictures. I don't know which ones you're talking about now. But
okay, now let's move on to the Botox. It looks like the eye, Botox to the eye.
Right. That's showing the crow's feet area. The one on the picture on the left shows before the Botox. The one on the right, the crow's feet can be significantly improved. In her case, she's not doing any squinting, but when it really shows up is when patients will smile or squint. It really helps the little crow's feet at that point.
Okay, we
so
just showed
excellent for that area.
Okay, we just showed the first one to the forehead, and that one you're looking at the eye right now. And then this, the third one we're looking at is Botox to the forehead. That's a big difference.
Yeah, it's similar to the first one, but a little bit more dramatic difference. The horizontal lines on the forehead can almost be completely washed out with this. The nice thing about it, if it's used properly, if you use the Botox properly, you still have a little bit of movement. It's not like you have this plastered artificial look. It's very natural looking if it's applied properly. And again, that's where training and skills of the injector do make a difference.
Well, and you sent over a chart, which I think is amazing. It's kind of the injectable filler, the length of result for all these different procedures. We're going to show that right now. And these last for quite a while.
The fillers are another category. Basically what they do is plump up the face, and there's a number of different fillers that are available. The little chart I'm not sure if you're showing that right now, but Restylane and Juvederm are very similar fillers. They're called hyaluronic acid, and they last for about 6 to 12 months. We have Radius, which is a calcium crystalline material, and that can last for 12 to 18 months. And then we have Sculptra, which is a different material that actually causes your body to create its own collagen, and it can last for up to 2 years. It's great for volumizing the face, plumping up the cheeks. It's an excellent filler. And then the last one is Evolence, which is a new collagen-based filler, and it's relatively new. The nice thing about Evolence is it may help reduce the amount of bruising that we see from some of these little injections.
Wow, I had no idea those things lasted that long. The next picture we're going to go to is Restylane. It's to the folds and to the lips. Also a dramatic difference in this before and after picture.
Again, it really can make a big difference. In this case, we injected it into what we call the nasolabial folds, which is the fold between the nose and the lips on the sort of the parentheses lines that people talk about. And it really helps plump that area up and reduce those folds dramatically. And also the lips. It's helpful for the little fine lines, the vertical lines that will run across the lip line and help plump that out so that women don't have problems with putting their lipstick on and running the lipstick into those lines.
And speaking of lips, our next picture we're putting up is Restylane to the lips to give that plump look.
Yeah, this is a little bit more dramatic. I mean, you can achieve it if you want to. A lot of our patients don't want to have a big, Angelina Jolie type lip, but some of them do. They really want to have some significant improvement, and you can achieve this with the Restylane and the Juvederm. The next slide will show it.
Yeah, the next one we're going to put up right now is the Juvederm to the lips. Also a difference.
Juvederm does a great job to help really give that voluptuous kind of a lip. It really is very, very effective and gives a very natural effect without any lumpiness or knots and bumps. And
you mentioned Juvederm. Our next shot is Juvederm to the folds.
Right. It's very good for that as well, the Juvederm to fill in those folds. And the patient that you see here just had it done. Literally, the after picture is immediately after it's been done. So you see that with a little bit of makeup on right away, patients are back in their activities with these. So they're very, very quick to do and very quick to get back into your activities.
Now we're going to quickly move through the last four here. We've got Radiance to the folds and then Sculptra. Can you kind of just highlight what those are?
Right. Well, the Radius is similar, but it lasts a little bit longer. It's great for the folds, again, the parentheses lines. It can last for 12 to 18 months. The Sculptra is a different filler, and it's good to plump up the cheeks. And this patient that you see with the Sculptra, it really can almost do what a cheek implant would do, and it's very, very helpful to volumize the face. We like it, and it can last for about 2 years, so it's a very long-lasting filler.
And the last shot is the Evolence, is that right?
That's right. Evolence is the newest of all the fillers. It's very similar to the others in that it lasts about 6 months to a year. But again, the advantage to the Evolence is it may cause a little less bruising in patients who easily bruise. That's the one characteristic of this particular filler. So again, these are the ones that we commonly use. They're all very safe, very effective, and very easy to bounce back from after they've had it done.
Okay, doctor, tell us your email and phone number through Talk of Alabama. We're going to put it on the bottom of the screen so viewers can get a hold of you if they want any of this stuff done. We can see it here on our screen at email Dr. Daniel Rousso at talkofalabama.com, and you'll be able to answer questions for viewers.
Absolutely. They can get in touch with us on our website. That really gives us the best information. It's at drrousso.com. That's probably the most informative things if they want to get to us, or they can call the office as well. And
that number is 205-930-9595, 930-9595. And these are all quick things that if somebody's got a reunion or something they need to look fabulous for in a short amount of time, you can fix them up.
That's great.
Thank you so much for your time, doctor. We'll check back with you in next Wednesday for Women's Wednesday.
Absolutely. We'll look forward to talking about some new things next Wednesday with you.
We appreciate it. Have a good rest of your day.
You too, Nicole.
And as you can see, that was Skype. Isn't that cool? Skype. Who knew the technology out there? Listen, when Talk of Alabama returns, we've got so much more. Stay with us.